The Maryland Department of Health, Developmental Disabilities Administration, Self-Directed Services Training Series, Module 13, Individual and Family Directed Goods and Services. Updated November 1st, 2024. This training is a summary with important information on individual and family directed goods and services. More information and requirements are found in the Medicaid Waiver Program applications, laws, regulations, guidance, and policies. The most updated information regarding self-directed services is published in the Self-Directed Services Policy and Manual that can be found on the DDA's website. Individual and family directed goods and services are services, equipment, activities, or supplies that are not otherwise provided through the Medicaid waiver programs or through Medicaid state plan services. Under the DDA-operated Medicaid waiver programs, individual and family directed goods and services are divided into three categories. Recruitment and advertising includes up to $500 of dedicated funding for staff recruitment and advertising efforts, including developing and printing flyers and using staff registries. Day-to-day administrative supports, which include assistance with household and personal management essential to maintain community living, not available under Medicaid waiver service or Medicaid state plan service, and other goods and services as listed in the Self-Directed Services Policy and Manual and Medicaid Waiver Program applications. As per the Federal Centers for Medicare and Medicaid Services, Medicaid Waiver Technical Guidance, individual and family directed goods and services must relate to a need or goal in the person-centered plan, and decrease the need for Medicaid waiver service or Medicaid state plan services, or support the participant to maintain or increase independence, or promote opportunities for the participant to live in, be integrated in, and be included in the communities of their choosing, and the participant does not have the funds to purchase the approvable item or service. Individual and family directed goods and services must not compromise the participant's health or welfare. Individual and family directed goods and services are provided to or directed exclusively toward the benefit of the participant. Individual and family directed goods and services are services that cannot be provided through the Medicaid waiver programs or through a Medicaid state plan service. Additionally, it is important to note that individual and family directed goods and services are not available for participants who choose the traditional services delivery model. The participant must identify savings within their annual budget to be used to purchase the goods and services. Savings may not be used if doing so would deplete the annual budget in a manner that leaves unmet needs or compromises the participant's health and welfare. The goods and services provided must be cost-effective alternatives to standard Medicaid waiver program services or other Medicaid state plan services. A participant may be eligible to receive funding for individual and family directed goods and services if the participant is enrolled in the self-directed services delivery model. The good or service is connected to a need that is in the participant's person-centered plan. The request meets the requirements of the Medicaid waiver program, policies, and guidance. The person does not have the funds to purchase the good or service, and all other funding sources for the good or service have been explored and documented in the participant's person-centered plan, including but not limited to Medicaid state plan, the Division of Rehabilitative Services, or DORS, the Maryland State Department of Education, and Department of Human Services. Individual and family directed goods and services category, recruitment and advertising. Participants who self-direct their services have the option to use up to $500 in dedicated funding for staff recruitment and advertising. Recruitment and advertising may include developing print or electronic flyers for sharing job advertisements, web or application-based software to create flyers, printing physical flyers to post in person, or memberships to staff registries and job posting sites. Recruitment and advertising does not include services provided by financial management and counseling services providers or support brokers. Recruitment and advertising, individual and family-directed goods and services are authorized in the person-centered plan. The funding is included in the detailed service authorization within the person-centered plan and does not need to come from cost savings. Recruitment and advertising must be included in the self-directed services budget sheet in order for the participant's financial management and counseling services provider to make any payments. The second category of individual and family-directed goods and services is day-to-day administrative supports. Participants who self-direct their services have the option to use cost savings to hire a day-to-day administrative supports provider. Day-to-day administrative supports includes direct and non-direct support not available under Medicaid waiver service or Medicaid state plan services, such as household management and scheduling appointments including medical visits, or personal money management. Day-to-day administrative supports cannot include tasks such as making decisions for the participant, or approving and signing timesheets or vendor or provider invoices. Day-to-day administrative support hours must be reasonable based on assessed need. Day-to-day administrative supports may be provided by an employee or vendor. Day-to-day administrative support employees must meet all requirements of employees listed in the Self-Directed Services Policy and Manual based on their employee status. Day-to-day administrative support employees must be paid a wage with taxes withheld following the DDA's established reasonable and customary standards. Day-to-day administrative support employees must receive any benefits that may be required by law, such as sick and safe leave. And day-to-day administrative support employees may receive benefits such as health benefits, paid time off, and increased holiday rates as determined by the employer. Day-to-day administrative support vendors must meet all requirements of vendors listed in the Self-Directed Services Policy and Manual based on their vendor status. Day-to-day administrative support vendors must be paid an hourly rate without taxes withheld following the DDA's published reasonable and customary standards. Participants can hire an employee or a vendor to be the day-to-day administrative support, including relatives, guardians, or legally responsible individuals. Participants and their teams must request day-to-day administrative supports through the annual or revised person-centered plan process. Person-centered plans must include an outcome that can be supported by day-to-day administrative supports. Person-centered plans must note how the day-to-day administrative supports helps to meet the outcome. The Self-Directed Services budget sheet must include the day-to-day administrative support wages for employees or rates for vendors in order for the financial management and counseling services provider to make payments. Day-to-day administrative support payments are made by the participant's financial management and counseling services provider. Employees should submit timesheets via the participant's financial management and counseling services provider's electronic payroll system. Clock in and clock out times are required, and electronic visit verification compliance is not required. Payments for vendors are paid based on approved invoices. Vendors should submit invoices to the participant for review. Invoice requirements and submissions must be in accordance with the DDA standards for invoicing listed in the Self-Directed Services Policy and Manual. This slide includes information regarding day-to-day administrative supports exclusions. A participant's support broker may not provide them day-to-day administrative supports. Employees may not provide any other waiver service at the same time that they provide day-to-day administrative supports. The last category of individual and family directed goods and services is referred to as other allowable goods and services. Participants who self-direct their DDA services have the option to use cost savings to purchase other allowable goods and services during their plan year. Requests must meet the definition and requirements of individual and family directed goods and services. This includes that the goods or services are connected to a need in the person-centered plan, that the request meets all requirements of the Medicaid waiver, programs, policy, and guidance. The participant does not have the funds to purchase the item or for service. The other funding sources for goods and services have been explored and documented in the person-centered plan, and supporting documentation is required when requesting this type of individual and family directed goods and services. Allowable goods and services include activities that promote health, such as fitness memberships and items, personal training, aquatics, and horse riding. Fees for programs and activities that promote socialization and independence, such as art, music, dance, sports, or other activities of the person's interest. Small kitchen appliances that promote independent meal preparation, such as air fryers, microwave ovens, or toaster ovens. Laundry appliances to promote independence and self-care, if none exist in the home, such as washing machines and dryers. Sensory items related to the participant's disability. Allowable goods and services also include safety equipment, personal electronic devices for health, safety, or communication, toothbrushes and electric toothbrushes, weight loss program services, dental services recommended by a licensed dentist and not covered by health insurance, nutritional consultation and supplements recommended by a professional licensed in a relevant field, internet services, and other goods and services that meet the individual and family directed goods and services policy standards. The DDA-operated Medicaid waiver programs include information regarding goods and services that are not covered under individual and family directed goods and services. Information is also included in the Self-Directed Services Policy and Manual. Goods and services do not include services, goods, or supports provided to or directly benefiting individuals other than the participant, or which have no benefit to the participant. Goods or services that compromise the participant's health or safety. Experimental and prohibited goods and treatments. Goods and services also do not include additional units or costs beyond the maximum allowable for Medicaid waiver service or Medicaid state plan service, with the exception of a second wheelchair. Co-payments for medical services or over-the-counter medications or homeopathic services. Items used solely for entertainment or recreational purchases, except as needed to meet an assessed behavior or sensory need, documented in a behavior support plan. Monthly cable, television, or telephone fees. Goods and services also do not include room and board, including deposits, rent and mortgage expense payments, food, utility charges, such as electricity bills, gas bills, and water bills, fees associated with telecommunications, except for internet services, tobacco products, alcohol, marijuana or cannabis products, or illegal substances, vacation expenses or deposits, Goods and services also do not include tickets, subscriptions, and related costs to attend recreational events, personal items such as clothing and shoes, haircuts, nail services, and spa treatments, with the exception that massages may be allowed based on the written recommendations of a medical professional and if not covered by health insurance, and non-cosmetic nail services may be allowed based on the written recommendations of a medical professional. Goods or services with costs that exceed community norms for the same or similar good or service, including items intended primarily for commercial use. Goods and services also do not include tuition, including post-secondary credit and non-credit courses, and educational services otherwise available through a program funded under the Individuals with Disabilities Education Act, including private tuition. Applied behavior analysis in schools, school supplies, tutors, and homeschool activities and supplies. Goods and services also do not include staff bonuses, housing subsidies, subscriptions to magazines, periodicals, newspapers, television services, or other recreational products, training provided to care providers, services in hospitals except for allowable dental services, insurance, vehicle maintenance, and any other transportation-related expense. Goods and services also do not include costs of travel, meals, and overnight lodging for staff, family, or natural support network members, service animals and associated costs, construction, remodeling, or maintenance of all at-home exercise rooms, swimming pools, and hot tubs, fines, debts, legal fees, or advocacy fees. Goods and services also do not include contributions to ABLE accounts and similar savings accounts, country club memberships or dues, leased or purchased vehicles, and items purchased prior to DDA approval of the request. Other allowable goods and services may be included in the Self-Directed Services budget sheet during the annual and revised person-centered planning process, but are not required to be included in them. All requests for other allowable goods and services must be requested using the DDA Individual and Family Directed Goods and Services Request Form. The DDA Individual and Family Directed Goods and Services Request Form is an online form used to request funding for other allowable individual and family directed goods and services. The DDA Individual and Family Directed Goods and Services Request Form is not required for recruitment and advertising, individual and family directed goods and services, or day-to-day administrative supports. The DDA Individual and Family Directed Goods and Services Request Form is required for all other requests to use cost savings to purchase individual and family directed goods and services. The Coordinator of Community Services is the only authorized team member who may complete the Individual and Family Directed Goods and Services Request Form. Allowable goods and services request must include supporting documentation. Allowable goods and services may be included in the self-directed budget sheet during the annual and revised person-centered plan process, but are not required to be included in them. In the following slides, we will share some examples of supported documentation based on the type of request submitted. Requests for activities that promote health require an uploaded invoice or other documentation of price for the activity, a schedule of when the activities will be attended, and documentation that shows that all funding sources were attempted. Requests for fees for programs and activities that promote socialization and independence require an uploaded invoice or other documentation of the price of the activity, and a schedule of when the programs or activities will be attended, and documentation that shows that all other funding sources were attempted. Requests for laundry appliances to promote independence and self-care require an uploaded invoice or other documentation of price for the appliance, and documentation that shows that all other funding sources were attempted. Requests for food-related appliances to promote independence require an uploaded invoice or other documentation of price for the appliance and documentation that shows that all funding sources were attempted. Requests for sensory items related to the participant's disability require an uploaded invoice or other documentation of price for the item, and documentation that the item was not covered by insurance or health plans, and documentation that shows that all their funding sources were attempted. Requests for safety equipment related to the participant's disability require an uploaded invoice or other documentation of price for the item, and documentation that the equipment was not covered by insurance or health plans, and documentation that shows that all funding sources were attempted. Requests for personal electronic devices require an uploaded invoice or other documentation of price for the item, and documentation that the device has not been approved by any other funding source, including through assistive technology in the person-centered plan, and documentation that shows that all funding sources were attempted. Requests for toothbrushes and electric toothbrushes require an uploaded invoice or other documentation of price for the toothbrushes and documentation that shows that all other funding sources were attempted. Requests for weight loss program services require an uploaded invoice or other documentation of price for the service and documentation that the service was not covered by insurance or health plans, and documentation that shows all funding resources were attempted. Requests for dental services recommended by a licensed dentist require an uploaded invoice or other documentation of price for the service, and documentation that the service is not covered by health insurance or health plans, and documentation that shows that all other funding sources were attempted, and documentation that the service was recommended by a dentist. Requests for nutritional consultation and supplements require an uploaded invoice or other documentation of price for the service, and documentation that the item is not covered by health insurance or health plans, and a recommendation by a medical professional, and documentation that shows that all other funding sources were attempted. Requests for internet services require an uploaded invoice or other documentation of price for the service, and documentation that shows that all funding sources were attempted. Individual and family directed goods and services other requests require an uploaded invoice or other documentation of price for the good or service, and documentation that shows that all other funding sources were attempted. The DDA will ask for additional documentation related to other requests in order to confirm the request is within the scope of the waiver service. Under federal guidance, one of the rules to authorize individual and family directed goods and services is that a person does not have any personal funds to purchase the item or service. For all requests, documentation that the person does not have personal funds is required. Examples of documentation that the person does not have personal funds to purchase the good or service includes banking accounts. Please remember that any request must be approved before the good or service can be purchased. Any services, goods, equipment, activities, or supplies purchased prior to DDA approval of the request is not allowed. Review of the Individual and Family Directed Goods and Services form. The regional office will review the request within 20 business days of receipt. All requests that do not include the documentation required will be returned to the participant and their team for clarification. If the regional office approves the request, the financial management and counseling services provider will process the request. If the regional office denies the request, the regional office will send the participant a denial letter with appeal rights. This slide includes useful resources. Summary. Individual and family directed goods and services are noted in 3 categories, including recruitment and advertising, day-to-day administrative supports, and other allowable. Recruitment and advertising is requested through the person-centered plan process and paid from funds in the detailed service authorization. Day-to-day administrative supports is requested through the person-centered plan and paid from cost savings. And other allowable goods and services are requested through the Individual and Family Directed Goods and Services request form and paid from cost savings. All individual and family directed goods and services must not compromise the health and safety of the participant, be provided directly to the participant, help meet a need listed in the person-centered plan, and not be able to be provided with another Medicaid waiver service or a Medicaid state plan, or available from another funding source. The participant must not have the personal funds to purchase the request. All individual and family directed goods and services requests must meet all requirements in order to be approved. This ends Module 13.